like to welcome Dr. Khalida Hai-Santiago, who will be our presenter today. Dr. Hai-Santiago is a member of the Healthy Smile, Happy Child Intersectoral Dental Health Promotion Group and oral health consultant with Manitoba Health and Shared Health. She's also the chair of the Council of Dental Directors, Oral Health Branch of Health Canada, and her dental career has primarily focused on community dental public health and providing dental care to underserved populations. So welcome, Dr. Hai-Santiago.
Hello. I think I can't see everybody, but thank you for being here today. Some of you look very cozy with a fireplace in the background there. Hi, Kristen, how are you? Looks good. I kind of think I dodged this bullet from Daniela for a few years because she was asking for a presentation about fluoride and water fluoridation for a while. Here it is. So I'm just going to preface that I am by no means an expert in about fluoride and community water fluoridation. I've just come come into it because of the nature of my position with the province. I do look after and monitor the community water fluoridation program for Manitoba, which there are several communities in Manitoba that participate. And in the nature of that position, I've been asked a lot of questions by the public, by health professionals, dental professionals, water treatment plant operators. And so you end up doing a lot of reading or looking at a lot of resources to gather information and, what are the credible sources of information and, where should you look? And so I'm also going to preface that all the information in this PowerPoint has been garnered from other sources, and I have references at the end. And do I know by no means own this information or the content? But we'll get started. So, if you do have questions, just enter it into the chat box. I tried to look at things that were continually coming up on different sites for questions that I have or statements that I've come across before or been asked before. So if you do have anything, just please type it into the chat box. If you have any burning anything, just stop me and we can discuss for sure. And there will be lots of time. So again, we're going to look at some of the myths and facts about fluoride and community water fluoridation. I am assuming that most people that are on board online right now have some information about what fluoride is and what water fluoridation is. Because to get, but I will be presenting some information around some of the facts that are listed. So I just put this slide together because this is all water. This is water. The left-hand picture is water at Lake of the Woods, where I am very privileged to be able to spend time at. Fresh water. This center picture is water coming out of a tap into a glass. The picture on the right is also water in a marshland at Lake of the Woods. And, marshlands and wetlands are very, very important to, clean pollutants out of the water as well too. And then bottled water, again, is another source of water as well too. So just listed these as facts. So fact one. So, fluoride, where does it come from? What is it? Fluoride occurs naturally in water, though it's generally not at a high enough level to benefit teeth. That would just be from any kind of water source unless it's been treated. So fluoride naturally exists in pretty much all water supplies. It is fluorine. Fluorine is the chemical element with the symbol F and the atomic number 9. For those of you stretching back to chemistry days, it is a member of the halogen family. And fluoride is the negative ion of the element fluorine. So when it disassociates, it's still the same, doesn't matter, you know, what source of water it's in or what it's in. So it's a mineral, again, that exists naturally in all water supplies, lakes, rivers, and groundwater. So the main sources of exposure of the general population to fluoride are through water, food, and beverages, and of course, dental products. So fact 2, fluoride is an important nutrient for healthy teeth. So those of us in the dental world, you know, realize and have seen the effects of fluoride and how important it is. It again is a mineral, and in minute amounts, fluoride in drinking water strengthens teeth. Fluoride is one of several examples of everyday products fortified to improve our health, such as iodine is added to salt, folic acid is added to bread and cereals, and vitamin D is added to milk. So, fact 3, community water fluoridation is the most cost-effective way to protect oral health and advance health equity. So it's the least expensive way to provide everyone in the same community with a form of cavity prevention. So water fluoridation is the controlled addition or reduction of fluoride in a community water supply. And we aim for water fluoridation at 0.7 parts per million, and this is set by Health Canada and the Drinking Water Regulatory Body. So communities, for example, in Manitoba, if their maximum acceptable concentration, which is set at 1.5, is over 1.5, those water sources or those water providers are notified, and they have to mitigate that, and they have to notify the community or members that it's over 1.5. And we have used water fluoridation to prevent tooth decay since 1945 in Canada, and Winnipeg has been fluoridating since 1956. So generally, it's costs about maybe $1 per person to fluoridate. In larger centers, it's going to be a little bit more in smaller communities. So fact 4, fluoridation actually saves money by preventing tooth decay. So evidence shows that across the US, and these are US statistics, obviously, people in fluoridated communities save an average of $32.19 per person. That would be in 2013 US dollars every year in reduced need for dental treatment compared to those without fluoridation. So that's from the CDC. You know, I'm thinking it's probably more. I mean, I don't have the evidence for that, but I would think that it's like you're probably saving more money than that, and that's just for the dental treatment. It doesn't take into the consideration, say, the time off from work to go to a dental appointment, transportation costs to get to a dental appointment, or your gas, parking, depending where the dental office is, and depending if you're, you know, child, somebody with a disability, or a senior, someone to escort you as well, to take you to your dental appointment. So it also kind of is on the fringe of access to care issues as well too. So this is a interesting statement. I'm sure everybody's has had read about IQ levels related to fluoride level or fluoridation. So fact 5, many IQ-related studies were poorly designed and gathered unreliable data or tested fluoride levels that far exceed those in the US or Canada. So most of these studies that cite a link to a lower IQ score in children were conducted in China, Iran, or India, or other parts of North America where fluoride levels are higher. And again, in many areas of these countries, again, the natural fluoride levels in water are many times the level used to fluoridate drinking water in the US or Canada. So they do a lot of great research in Britain and Ireland. Not that we don't as well here too. In North America, British researchers who evaluated these studies from China and other countries found basic errors. They pointed out that lower IQs could be traced to other factors such as arsenic exposure, the burning of high fluoride coal inside homes, and the eating of contaminated grain. Because sometimes the fluoride will leach out from other industries as well. And so many experts in psychology and neurology have questioned the design and methods of the Canadian fluoride IQ study from 2019 that is most frequently cited by opponents of fluoridation. These experts questioned the validity of the study's conclusion, given that a number of potential confounding factors, such as what is the IQ score of the mothers, were not available or taken into account. Also, the study's authors did not explain why there was no link between IQ scores and whether children were born and raised in a fluoridated city. Any questions thus far? We can do a check-in shortly again. Okay, fact 5. Again, fluoridation is a public health measure, a cost-effective community investment that benefits everyone regardless of age. So again, I've said this a few times already, it already exists naturally in water supplies. So it's not necessarily a question of choosing, but a question of assuring that people receive the right amount to prevent tooth decay, which is set at 0.7 parts per million. And it's equitable because the entire population benefits regardless of individual financial circumstances or resources. And public health decisions are made based on what benefits the whole community on unbalanced scientific evidence. So everybody knows now what public health is about in Manitoba and across everywhere around the world and in Canada because of the recent pandemic. And so, public health is looking out for what's best for everybody and all the populations. And so we consider that fluoridation, especially water fluoridation, is cost effective and will benefit the population. It, it doesn't know where you live. It doesn't know what kind of clothes you wear or what kind of car you drive. It doesn't check your bank account. It just fills a need that when you drink the fluoridated water, it'll help with reducing decay. So facts 7. So dental fluorosis. So high fluoride concentrations can lead to dental fluorosis, but it would have to be very high fluoride concentrations, generally over 10 to 15 parts per million that you would get an exposure to for years. Nearly all fluorosis in Canada is mild. This condition is not painful and does not affect the health or function of teeth. So dental fluorosis is faint white spots that can form on the enamel of teeth, which can occur during the tooth development years up to age 8. So, once your teeth are developed, you don't get dental fluorosis. If you're having other issues, it's something else going on. And it's if children are exposed to too much fluoride. So the Canadian Health Measures Survey, which is being redone currently from 2007 to 2009, found that so few Canadian children 6 years to 12 years old have moderate or severe dental fluorosis that even combining the categories, the prevalence is too low to allow reporting. So again, what that means is that, again, nearly all fluorosis in Canada is mild and that it just doesn't show in children, and that as dental professionals may be able to pick up on it. Really in Canada, we don't have moderate or severe dental fluorosis, which can be, the whiter areas, the pitting, the yellowness, or the enamel is kind of flaking away or breaking away. That would happen. You might see that because somebody has emigrated from another part of the world, and you're seeing them now as a dental professional or in maybe some of your health clinics, and that you might have to treat that now, but it's not because because they've been exposed to a lot of fluoride in their drinking water when they were growing up. Again, in 2015, the US Public Health Service updated its recommended level of water fluoridation to 0.7 parts per million. They used to be set at 1.2 parts per million to reduce the likelihood of fluorosis while continuing to protect teeth from decay. They also used to have, here in Canada, as I said previously, our maximum acceptable concentration, or MAC, not to be confused with a Big Mac, but as 1.5 parts per million. And in the US for years, it used to be 4.0 parts per million. So they were starting to see an uptick in mild or very mild or mild cases of dental fluorosis because they do surveillance for that. And so then in 2015, they dropped that MAC down to, I think it was 2.0 parts per million to mitigate that. So, and as all you dental professionals know, really mild dental fluorosis is not of an aesthetic concern. You would not generally be treating that because it's generally not noticeable. You might be seeing people from other parts of the world where you would have to intervene and do some sort of restorative, depending how severe the dental fluorosis is. Fact 7, getting enough fluoride in childhood is critical to strengthening teeth over an entire lifetime. So infants and children need fluoride to strengthen their growing teeth. Of course, we have to mitigate this with not having any dental fluorosis. Fluoridated water benefits developing teeth even before they are fully visible in the mouth. The use of fluoridated water to prevent enclosed cavities, again, is both safe and effective for children. And we know that, your experience or your clients or your patients' experiences in childhood can affect how their dentition and their dental health into adulthood. So children who drink fluoridated water as their teeth form will have stronger teeth that resist decay better over their lifetime. Again, a 2010 study confirmed that the fluoridated water consumed as a young child makes loss of teeth due to decay less likely 40 or 50 years later. I mean, anecdotally, as a dental professional, you can tell when somebody has not had that fluoride experience, either from water fluoridation or water or dentally applied fluoride treatments. It can show. So again, this is also an important fact. Children who swallow toothpaste are increased risk of mild fluorosis. So again, the bodies in the US, like American Academy of Pediatrics, Pediatric Dentistry, and American Dental Association, recommend, as well as the CDA and Health Canada, fluoride toothpaste is recommended as soon as the first teeth come in. So generally, kids, there is the risk for dental fluorosis is when the kids aren't spitting what's in their mouth. You need to be watching what they're doing. They need to be supervised. Some kids, older, my son used to fake me out and wet his toothbrush. He was like 12 or 13 and didn't think I noticed that he wasn't brushing his teeth. So it just depends on the kids. So you cannot leave that tube of toothpaste laying around. If there's going to be cases of mild or dental fluorosis showing up, mild fluorosis, is because the kids maybe they got hold of the toothpaste, they swallowed a little bit, and they kind of do that again. And so you cannot leave that toothpaste laying around. So that's why it's important to follow proper guidelines on the correct amount of toothpaste to use, supervise when they brush, and teach them to spit rather than to swallow the excess. But it's sweet, so you really have to monitor that. And I do have a slide coming up after showing the amounts that you would use for different age groups. So a warning label exists on toothpaste because of the fact that it contains a higher concentration. Most toothpaste start at 1,200 to 1,500 parts per million, which is a whole lot more than water fluoridation, which is, we aim for 0.7 parts per million. And that's a lot. That's why you cannot leave toothpaste laying around. And the higher, more, for people that are, medically compromised, there's the higher toothpaste that have, up to or more than 5,000 parts per million. And there's also products like, the silver diamine fluoride, SDF, and fluoride varnish, which are over 20,000 parts per million, that you cannot generally, you're not going to buy those types of things at the supermarket or at Shoppers or anything. So fact 10, fluoridated water is safe for babies and young children. Other than the fact that they're getting fluoride from, other beverages that they consume, if it's been made with fluoridated water, or it's been produced at a food facility that uses fluoridated water, they're going to get it in the food that they eat because it's been incorporated as it was growing in the soil, depending on the fluoride content of the soil. So several studies have explored the link between, fluoride and negative cognitive effects, but the findings are not consistent. Again, it was on the previous slide where they were talking about the IQ studies conducted in Canada and Mexico have reported associations between the two, but studies from New Zealand and Sweden have found no such link. And a study from Spain actually found a link between fluoride and a positive effect on boys' cognitive performance. So, we have to look at what's balanced information. So the American Dental Association states that doctors or, other healthcare professionals can suggest the continued use of powdered or liquid concentrate infant formulas reconstituted with optimally fluoridated water. And again, parents should discuss any questions they may have with their healthcare providers. So I do have some more slides coming up about that if anybody has any more questions. So fact 11, many health and medical organizations agree fluoridated water is both safe and effective. I could have certainly listed the number of organizations, but leading health and medical authorities support water fluoridation as safe. Health Canada and CDC, which is the Center for Disease Control in the US, Disease Center, support that the panels of experts from different health and scientific fields have provided strong evidence that water fluoridation is safe and effective. More than 1,600 studies or reports have been published on the subject of fluoridation, making this one of the most researched topics in public health. So I usually find some of the controversy with fluoridated water is that it's being forced on you. I've had people tell me that they don't take hot showers because it concentrates the fluoride. And people just don't want, to take something that they're being, forced to consume. I mean, you can put in a reverse osmosis system into your water source into your house if you want to. A lot of people will drink bottled water. Some water companies advertise that their water has no fluoride, and I have a couple of slides coming up about that as well. So it's, whether you want to consume that. But if you're not going to be consuming fluoridated water, then I would just say You better not, you need to look at your consumption of where your wine comes from, because wine can be like 4 to 6 parts per million. Where does your food come from? It's just naturally there because fluoride is just in our system. So fact 12, dozens of studies and 75 plus years of experience have consistently shown that water fluoridation reduces tooth decay and fluoridation. Sorry, not the end fluoridation, just reduces tooth decay. So the CDC, again, cites it as one of the 10 greatest public health achievements of the 20th century. A lot of people have seen this statement probably for years, and I mean, it's true that, they started in the 1940s. They started doing, noticing that people in certain areas of the US were not getting cavities the same as everybody else, although they were getting some fluorosis because the fluoride levels were so high. And they linked it to the level of fluoride in the drinking water. So research has shown that tooth decay increased significantly in cities that had ceased fluoridation. The one relevant to us in Canada is when Calgary stopped fluoridating in 2011. So a 2021 study showed that the rate of decay, tooth decay of its second graders was lower than the rate in Calgary, than in Edmonton. Edmonton had the lower tooth decay rate, but after fluoridation ended, the study revealed that Calgary's rate increased significantly, while surpassing the rate in Edmonton where fluoridation continued. And I think it was something like 3.5 or 3.8 surfaces, which is, in the dental world, that's a lot. That's a lot of surfaces. That's a fairly significant filling for a child to have to experience. So another study in US, a 2022 study compared dental health in 2 Alaska cities, Anchorage and Juneau. 5 years after Juneau ceased fluoridation, their cost of Medicaid dental treatments, and Medicaid is like there's government subsidized dental program, jumped by the dental treatments for children had jumped by 47%. And by contrast, these costs only rose by 5% in fluoridated Anchorage. So adults benefit from fluoride too. Actually, most populations that are high risk will benefit from fluoride because that's where the gains will be the greatest. 2007 review of studies found that fluoride prevents tooth decay amongst adults of all ages, and that fluoridated water prevents decay by about 27%. So I just put this slide in just in case people want to kind of see where we're at in Canada with water fluoridation. So this is from the Community Water Fluoridation Across Canada document that was just updated by the Office of the Chief Dental Officer in Canada in 2022 with the help of all the provinces and territories in Canada. So it just shows the dark blue is the most. We do a fair amount here in Manitoba, Ontario, and Northwest Territories. There's different reasons why communities may not, and why communities may not fluoridate. Saskatchewan is supposed to have Regina join back in a few years. Alberta has Calgary joining back to water fluoridation in a few years as well too. So those numbers will increase for Alberta and Saskatchewan. And this does not include well water, because well water will have its own natural background level of fluoride, and you can get that tested if you are on well water, just to see what your fluoride is in your water source. And I think your local water testing lab can do that for you if you provide them a sample. And also some communities may not fluoridate because their background level from their water source is fairly close to 0.7 parts per million. They may not choose to add fluoride, because fluoride is the last thing that's added after the water goes through a water treatment plant and system. Okay, so fact 13, millions of people living in Europe are receiving the benefits of fluoride. So this occurs in several ways. Fluoridated water reaches over 13 million Europeans, mostly residents of Great Britain, Ireland, and Spain. There is some fluoridated milk programs, mostly in Eastern Europe. This is not a popular way of fluoridating because it's unstable and it doesn't sit well, so that's not done a lot. Salt fluoridation is the most widely used approach in Europe. I'm not sure how many people are aware of that. In at least 70 million Europeans consume fluoridated salt, and this method of fluoridation reaches most of the population of Germany and Switzerland. So you may not be aware of that. And so in their stores, they would have fluoridated salt. I'm sure some stores would also have some maybe non-fluoridated salt, the available if people want to purchase that, but mostly it's mandated by their governments that they sell fluoridated salt. And so that trickles down through all their food processing, that trickles down to all their restaurants and into people's homes. So again, why is not more of Europe doing, water fluoridation? Because you have to have a good potable water treatment system and a plant. Where here, in Manitoba, for example, we're so flat, it's easy to get things set up so you can pipe water all over the place. If you live in the mountains and you can't drill through a mountain and it's hilly terrain, most people are probably on a local water source or probably well water, or they have water brought in. Again, France and Switzerland, for example, parts of Switzerland, water fluoridation is logistically difficult, again, because of terrain and because there's tens of thousands of separate sources for drinking water. So that's why parts of Europe rely more on salt fluoridation, fluoride rinse programs, and other means to get fluoride to the public, which would be, probably in a dental office or in schools or other ways. Also, salt fluoridation is very popular in Central America as well, and countries like in the Caribbean, like Jamaica. And generally, when they provide their fluoridated salt in a store, it's generally fluoridated to a level of 225 to 300 parts per million, which is a whole lot more than water fluoridation, and generally a whole lot more. And do they find that they have a lot of dental fluorosis in these areas? No, because you're really not eating a lot of salt. You're, just sprinkling a little bit of it. I see there is one question. 66, Tracy, I saw that. Okay, maybe I can have a sidebar with you, but I think that was the information that was sent to when Dr. Taylor's office requested that information, but I can have a sidebar with you after if you want. Okay, fact number, okay, why is it? Oh, questions. Okay, I have a few other questions that I've added as well too. And just gonna do, okay, thanks, Tracy. All right. Okay, so just some other questions that I've put in here. So what are some sources of fluoride intake? So, a good chunk of it comes, 75% of a person's fluoride intake comes from drinking water with added fluoride, and from fruit and beverages like soft drinks, fruit juices. I'm going to put everything in there like wine, coffee, tea tea, depending where the tea is grown. If it's grown in a mountainous area, I think it's like igneous rocks that have a lot of fluorine or fluoride in them. It will be incorporated into the tea leaves, and then when you make your tea, it's there. Also, while people's, again, we've talked about this already, but while people swallow small amounts of fluoride from toothpaste and dental products like mouth rinses, gels, and we should not be using foams because they don't work as well. Sorry that that's in there. And children swallow larger amounts and should be supervised during use, as we talked about. Again, children may also take doctors prescribed supplements that include fluoride, like tablets or drops, especially in a non-fluoridated area. You know, again, you need to talk to your dentist or your dental healthcare, your healthcare provider, your physician, whether you're going to be supplemented with drops. Can I use fluoridated water to prepare infant formula? Well, there's a couple of caveats with that. Because most infant formulas contain low levels of fluoride, you know, regularly mixing powdered or liquid infant formula concentrate with fluoridated water may increase the chance of a child developing, you know, the faint white markings or specks from of mouth fluorosis. But yes, you can use fluoridated water because it's just, you have to, you know, that's also going to be a personal choice. But if you're in an area where there's not fluoridated water, use fluoridated water for preparing infant, definitely use of infant for fluoridated water for preparing infant formula. But because, you know, if your child is only consuming infant formula mixed with fluoridated water, there may be a slight increase for mild dental fluorosis. But mild dental fluorosis, remember we talked about that. It's mild, you're not going to see it. So, you know, you got to outweigh the benefits of not having any fluoridated water versus having some fluoridated water. But at 0.7 parts per million, you should be fine. Your child will be fine. To lessen this chance, if you're worried about it at all, parents can use a low fluoride bottled water some of the time to mix infant formula. And these bottled waters are labeled as deionized, purified, demineralized, or distilled, and without any fluoride added after purification treatment, like after going through the water treatment plant. I think I have a picture of this coming. Okay, after. So what is the proper use of fluoridated toothpaste for children? Toddlers and infants and toddlers 0 to 3 years or 36 months. If your child is under 3 years old, you should consult your health professional or dental professional to determine whether your child is at risk of developing tooth decay. So we do have a caries risk assessment tool that was developed by Dr. Schroed and his team here in Manitoba, where it will help you assess what the risk factors are for any given client or patient. If your child is at risk of developing tooth decay, then they should have their teeth brushed by an adult using a minimal amount, rice-sized grain of fluoridated toothpaste, just to smear so they don't swallow it. So there's nothing left for them to swallow. This is a smear, just a little tiny, itty little bit on a pediatric brush. And as soon as teeth come in, they should be cleaned, whether it's being wiped down or whether it's with a small brush with a tiny smear of toothpaste, and just wipe it out, wipe out the toothpaste. Children aged 3 to 6, you should always help a child under the age 6 to brush their teeth. And in my case, my son, apparently 12 and 13, needed help with it at that age too. Use only a small amount, a small green pea-sized or 5 millimeter maximum of fluoridated toothpaste. And once your child is 6 years old and older and has developed the ability to spit out toothpaste, they are ready to start supervised toothbrushing using toothpaste that contains fluoride. So pea size, there's a nice little green pea there to show you how much that is. And usually I find most, the first mouthful, you brush and you spit out most of it anyways. Just make sure they're spitting it out. And if you have to, wipe it out. Can I use bottled water to mix baby formulas? There's a lot of bottled water around. Lots of different companies in Manitoba, Canada, elsewhere. Yes, you can use bottled water to mix powdered or liquid concentrate, but be aware that for the fluoride content or what it is, because it varies. I think I have a little bit of a picture coming up. Again, the whole thing is about the amount. If your child is exclusively consuming infant formula reconstituted with fluoride, that contains water that contains fluoride, there may be an increased chance again for the mild dental fluorosis, which really doesn't show up. Again, you may choose to use low fluoridated bottled water some of the time. Again, deionized, purified, demineralized distilled water without any fluoride added after purification treatment. Again, is it safer to drink bottled water because it has no fluoride? Well, it's handy. If you're traveling, depending where the bottled water is from, yeah, probably. But because it has no fluoride, some bottled waters, contain fluoride and some don't. It could be naturally occurring in whatever source water or the spring water used for bottling it, or it could have been added at the end when it came through their water treatment plant. Bottled water may not have a sufficient amount of fluoride, which is important for preventing tooth decay and promoting oral health. And again, read the label, check the source of the water. And again, it can be naturally present in the water source. So I just checked on this. So, I think this is the Walmart brand. Not that I'm promoting, that's the only bottled water in town, a natural spring water. Calcium, it has some calcium, which is good. But it doesn't have any fluoride. Let me just go back there, nutrients. Yeah, sorry, I couldn't see my bottom of my slide there. It says fluoride way at the bottom, 0. So no fluoride in that at all. So that is what, if you want to use natural spring water, this one from Walmart doesn't have any fluoride in it. Okay, this is another one, another brand. It's spring water. And it says fluoride 0.7 ppm, parts per million. So this one does have, some fluoride in it. 0.7 parts per million, which is 0.3 away from what we would aim for in our community water fluoridation programs. So just to finish off here a little bit, fluoride doesn't belong in water. Just a blanket statement. Well, it's already there. It exists naturally and in virtually all water supplies, and even in various brands of bottled water because it comes from their source. If you thought that you can't consume fluoridated water or fluoride in water, and you're trying to avoid it because it's causing some health problems, they would no longer drink water or any kind of juice or eat shellfish, meat, cheese, or other foods that contain trace levels of fluoride. And also what's being discussed is the amount, sorry, I missed the word discussed there, is the amount of fluoride in water. There are proven benefits for public health that just come from having the optimal level of fluoride in water, just enough to protect our teeth. And again, drinking water guidelines here in Canada, we aim for 0.7 parts per million. And that's our goal, just getting enough to help all of us keep our teeth longer. And especially when you get older and you're not able to look after your teeth, you're going to be reliant on other people. So these are some of the references that I've poured over in the last week, and some of the sites as well. And again, just reiterating that there's always different varying sources of water, and generally most water sources will have some detectable level of fluoride, unless it's a spring. Those types of things may not have a detectable level, or non-detectable. That's how some of the water companies, it's non-detectable, that it's just so low you can't even, it's very, very low.